So in this video, we're going to be talking about how to pour up models. We've taken an impression on a patient. We now need to pour those models up in yellow stone so that they can be used to make a retainer or some other type of orthodontic appliance. So if the impression's already been taken, then that's been done in the treatment area. And what should have taken place is the impression should be disinfected. You take your disinfectant spray, spray the inside of the impression where the teeth are. The patients are going to have plaque and oral bacteria. So in order to disinfect the impression, so that way when we pour the model up, we don't have that bacteria transfer to the model, we spray the impression very well, then rinse it with water. The alginate is a powder mixed with water, so we have a watery material, and it is now the negative for the model that we're going to create. But if we allow the impression material to dry out, then it will distort. So what we do is, as you can see here, we store the impressions after they've been disinfected, wrapped in a paper towel that is saturated with water, so that way if for some reason the impression had to be stored for a period of time before it's poured up, it shouldn't distort. If you do have to store it longer than by the end of the day, it should be stored in a bag in the refrigerator. But what we try to do is pour up all the models before the end of the day. That's the best practice. The other thing that you'll see here is we have a lab prescription next to each impression. Okay, now for two of these individuals, we took two impressions because they're getting upper and lower, or in one case, we are making two appliances for the upper. We only need one lab script per patient, so that's why you see one lab script and two impressions for those two individuals. The important thing is that nothing should come from the back into the lab, or excuse me, nothing should come from the treatment area into the lab without some sort of name tag. If you don't have a lab script available, write the patient's name on a piece of paper, store it with the impression. Best practice is don't let it get back to the lab without the doctor writing out the lab script, so that way, one, it's identified, so it doesn't get confused with somebody else's impression. Two, that way the doctor's already written down exactly what appliance he or she wants made as soon as the impression's taken. There's no second guessing it. You don't have to go back and look in the chart, trying to remember. No mistakes are made that way. So write out the lab script, use that as the identifier when you store your impressions. Make sure you disinfect the impression and wrap it up in a saturated paper towel to keep it moist. Now, pouring up the model just requires a couple of steps. Okay, so we've got our stone here. This is yellow stone. It's just called yellow because it comes out a shade of yellow. It's more orange than yellow, but they have different shades of stone: yellow, blue, green, white. For our working models, currently we're using yellow. The yellow stone, I've already put it in the bowl. I didn't measure it. All you need to do is when you add the water, you add enough water to make sure you get the right mix, and I'll show you that. But what I'm trying to say is that there's no individual portions of mixtures of this stone in our lab. In some offices, in some labs, they'll have individual portions that tell you this much stone with this much water. You don't need that. We don't have that, and I'll show you how to get the right mixture without that. We store our stone in this Tupperware container here. If this Tupperware container is empty, then you make sure that you fill it when you finish using it. But right now there's plenty of stone in there, and we've got the bowl of stone here waiting to be mixed with water. And then this is the vibrator. We use the vibrator to, once we've mixed the stone up, the vibrator will loosen the bubbles that are in the stone. Again, the stone is mixed with water. So when we stir it up vigorously, it incorporates some air. We don't want those bubbles to stay in the stone, because when we pour the model up, then there will be bubbles in the model that will make the model not as good of a representation when we make our appliance. So I'll show you how to use that vibrator. So we've got our stone, our bowl, we've got some spatulas over here. That's pretty simple. We've got our vibrator, and we've got our impression trays. So first thing is, we have multiple impressions to pour up, so we're going to organize our impressions with our lab scripts, our name tags, so we know what's going where. We're going to get it all set up first. So as you can see, all I'm doing is now I've positioned these impressions with the lab scripts that correspond to them. We don't need the paper towel anymore because we're going to pour them up, so let's just get rid of this. All right, now, you don't have to have the lab script and the tray positioned identically to the way that I have them. As long as you know what lab script corresponds with what impression tray, that's all that's important. However, to that end, when you get finished working on them, you need to make sure that they're clearly organized so anyone else, while the stone is setting, anyone else can look and be able to tell clearly this is patient number 1's impression, patient number 2's, well, it'll be model now that we pour it up, patient number 1's model, patient number 2's model or models. We have to make sure they're organized and clear so that they don't get confused. If we confuse someone's impression with another person's and they get to the wrong lab script, we're going to make the wrong appliance. It's going to be put in the wrong drawer to be delivered at the wrong office, and you want to avoid that for everyone's sake. So we've got our impression trays sitting there organized. What we're going to do now, we're going to mix our stone. So we come over to the sink, get your water going. I like to use cold water. If you use hot water, you can set up a little bit faster. So you just pour a little water in there. And basically what we're going to do, the combination, the ratio of water to stone is you want to just have enough water that all of the powder is mixed into it. So you can see right now that it started out seeming like it was really runny, but it's actually pretty thick and we still have quite a bit of powder. So we need a little more water. So you add a little bit of water. A little water goes a long way. So you don't want to add water by large amounts. You add by small amounts until you know you have the right consistency. Still need a little bit more water. And now we should be getting pretty close here. Okay, you can see there was nothing scientific about the amount that I put in there. All I am doing is visually looking to see do we have a complete mixture of water and stone, or do we have dry powder that's still mixed in there? And then we do want it to be, you know, somewhat movable, right? It's liquidy. We can move that stone around. We don't want it to be solid because then it won't mix in, but we don't want it to be too runny. If it's too runny, then it will take much longer to set and it may not set properly. So there's a little bit of stone still left at the bottom of this bowl. That's what I'm digging at right now, trying to make sure that I get that incorporated into the liquid. And now you can see that, you know, even though it's runny, right, it's still holding some shape. So it's not like it's just a liquid, but if I move it around, you see that it will drip. Okay, that's an important concept to understand. Movement, vibration, will cause this stone to move in a more liquid fashion. If we just set it right there, it'll stay in that same position. It may not move at all. It'll set up in that position. So, keeping that in mind, turn your water off. Come on over to the vibrator. That's going to be a little loud. Turn your vibrator on. Okay? When you set your vibrator up, make sure that you have a plastic bag over top of it so that the stone doesn't drip onto the vibrator and mess up the equipment. Just going to pull it a little closer to me so it's easier to work with. And now what you do is you make sure your vibrator is up high enough and you press the bowl down on the vibrator, and what you're going to see the little bubbles that are starting to come to the top? The bubbles will come to the top, they'll pop open. That's the air that I was talking about that we mixed in, leaving the stone. Now if we didn't use this vibrator and get rid of those bubbles, then the bubbles might end up in the model that we pour up, And say a bubble gets right on the tip of a tooth that we're trying to work on as we make our appliance. Your lab technician is going to have a hard time making an appliance that fits properly if the tooth is not whole because it has a bubble in it. Now, we're not done with the vibrator. We've mixed it and tried to get all the bubbles out. Now what we're going to do is we're going to take each impression and we're going to start with just a little bit of stone. We're going to hold the impression tray on the vibrator. Okay? We take a little bit of stone and we let that stone travel by putting it right in the pallet. We're going to let it travel from one end of the arch to the other. So we're not adding the stone all the way around the arch. We add it at one end, and then we watch the stone flow from one tooth to the next, from one end of the arch all the way to the other end of the arch. If the arch gets shallow and it's not completely full and you need to add more stone, it's fine. Add a little more stone, but add it in the same place. Don't just keep adding stone in different places. You can see the bubbles that are starting to show up and make their way to the surface. And for right now, this is as much as we need to fill this impression with. The stone is still pretty liquidy in our mix. So before we fill this impression tray all the way up and include what we call a base, we're going to pour up the rest of the impressions. Now, take a look here. This is an impression that was just taken. There's a void here. That's not the patient's tissue. That means there was no alginate there. Now, fortunately, the appliance that he's going to need, we can make it without having this here. There's also a void here. So I've already approved this impression when I saw it, when it was taken rather. So, same process. We're going to start in the back. You can see how the stone is flowing. This patient had a bigger mouth, so we're going to add a little bit more stone right from the beginning. Flow it around the arch. I'm going to turn our vibrator up a little bit, speed this up. Back in the same spot so we don't get confused whose impression that is. Same thing, this is a lower. Same process. You add a little bit of the material to one end of the arch. work with. That gives them stone to hold on to, stone to trim away when this is done setting and they get ready to work on it. Okay, so that's one that's basically done. You can see. Let's turn this off for a second. You can see this is where the impression tray ends. Okay, I can feel the end of the impression with my spatula, and we've got about maybe a 1/4 inch of material for a base just above that. Oftentimes you don't even need a 1/4 of an inch. You can do it with an 1/8 of an inch. You just want to add a little bit of a base, so we give the stone, some size, so it can, sustain itself. If we just poured it up this far and all we have was the teeth, it'd be really fragile, and we wouldn't have as much to work with. So same thing here. I'm not even going to use the vibrator. A little trick here. I told you how if you move the stone, that allows it to flow. I'm not moving this nearly as quickly as the vibrator does, but you can see how I'm getting it to flow into all the spaces around the arch. So, we don't have to turn that loud vibrator back on at this point. Normally I would use the vibrator, but since we're recording this and we want some audio, I don't want to have to keep yelling over that vibrator. But I just taught you a little trick there. Okay. So again, we've created a little bit of a base there. We've got ourselves maybe an 1/8 of an inch to a 1/4 of an inch of a base. Okay. And we just have to continue doing that on the rest of the impressions. Now, again, this was our one lower. So the lower is just a little bit different because there's a tongue space there. So it's not quite as simple to just, plop the stone right on top and, build up your base, so to speak. So you have to kind of go around the arch with your lower. Again, what I'm doing here is I'm just flowing it so we make sure we get all of the anatomy filled in. All right, and the other reason why if we're doing multiple impressions, the reason why we do the base last and fill in the teeth first is because now once the stone is set up, we can manipulate it more easily, and so we can create our base with more ease. If the stone were still pretty runny, then good luck trying to fill that base up and get it to kind of sit on top like we have for these three. So we're getting down to the end of our bowl. Looks like I did a good job of measuring how much stone we would need. This should be enough to build our base for our last two impressions. If you were a little short, then that's not a major problem. You can just fill it up as far as you can, fill the impression tray with stone as much as you can, get as much of a base as you can, and then you can mix some more stone. If you have too much, then you just toss out your extra stone if you don't have any more impressions to pour. If you just have one impression to pour, then you just don't need as much stone. So maybe we're just a little bit. Maybe I could have had a little bit more stone. Maybe I added too much of a base to the first three. I was a little more liberal with those, and maybe we just are gonna just make it for the base on this last one. Looks like we just made it. Now I almost confused these. This belongs to this young man, so we're going to put that back up where it belongs. Alright, and this is why it's so important to take good notes. Alright, why we have to be thorough with what we write down. Our lab script tells us that this person needed 2 models, upper and lower, and for this person, just 1. I moved this and put it down over here. So if I wasn't paying attention, and if I hadn't written this up properly, I might not know if this person had 2 or this person had 2. Did I put this back in the right spot, or did I put it in the wrong spot? That's why it's so important to use good notes. Write down the names, write down what they're getting. It'll make it easier to try to put everything back where it's supposed to go. All right, now for cleaning, you can see that we didn't make much of a mess here. Our work area is pretty clean, very neat. You got a little bit of stone here on this plastic bag. It's the end of the day, so we probably could just toss that bag and put up a new one tomorrow. But it's not a whole lot of stone that's there. We can even just kind of peel this little bit of stone off, and somebody probably can use that tomorrow. The stone, if you don't have much in your bowl, one, you can just kind of get rid of what's on your spatula by pushing it up against against the bowl. And then if there's not much in the bowl, then you get whatever bulk is left, toss that in the garbage, and then the rest you just get a paper towel, a wet paper towel, and clean your spatula and your bowl. It's going to take about 20 minutes for those models to set. Okay, so it does take some time. Again, wet paper towel. Clean out the inside of the bowl. We cleaned out our spatula. And sometimes it's even easier to clean this out once the stone has set up. But this is pretty good. It's pretty clean. So toss that down into the garbage. And you're done. Make sure you put everything away when you're done. That's it.